Mr. President, I take this time to explain 4 amendments that I have filed that would like to make pending on S-524. I understand that we're in a position now that we need consent in order to have these amendments pending, and I'm not going to ask consent, but I am going to explain the 4 amendments in hopes that I'll have an opportunity to present these amendments and have them considered by the full Senate. I know that Leader McConnell wants an open amendment process. I think all 4 of these amendments are very much relevant to the underlying bill, which is aimed at authorizing the Attorney General to address the national epidemics of prescription opioid abuses and heroin use. The first amendment I would like to talk about is an amendment that I'm joined by Senator Cardin. It's amendment number 3421, which would allow grants for 24/7 treatment centers. I am proud to join my colleague, Senator Cardin, in this amendment, which clarifies that grants under Section 301 of CARA may be awarded for the establishment and support of treatment centers that operate 24 hours a day, 7 days a week, to provide immediate access to behavioral health services. The epidemic of opioid abuse and addiction impacts every state in our country, and many of us know individuals and families who have been deeply affected by this tragic crisis. Heroin and opioid drug dependency has more than doubled in Maryland over the last decade. The number of deaths related to heroin and opioid drug dependency has increased by more than 100% in the last 5 years. In 2013, there were 464 heroin-related overdose deaths in Maryland, greater than the number of homicides. Some parts of Maryland have had the highest per capita rate of heroin and opioid drug use in the United States. In some regions of the state, an estimated 1 in 10 citizens are addicted to heroin. Improving access to behavioral health care, meaning both mental health and substance abuse treatment, is essential in combating this epidemic. According to the National Alliance of Mental Illness, more than half of the individuals with substance use disorders also have at least one serious mental health condition. There is often a small window of opportunity for getting an individual with substance abuse or mental health issues into treatment. If treatment cannot be provided on demand, often the opportunity is lost. Allowing grants for the establishment and support of 24/7 treatment centers providing behavioral health services on demand will help ensure those individuals in need have access to behavioral health services at the time they need it. I would ask my colleagues to join me in helping getting this amendment pending and passed. It's a bipartisan amendment, as I said, that I'm joined with Senator Cardin in presenting to our colleagues. The second amendment, Mr. President, is pretty simple. It requests a GAO report on naloxone price increases. I am pleased that this amendment that I would offer would require a study in the most recent dramatic increase in the price of this medicine. Naloxone is a life-saving drug that is used to reverse the effects of opioid overdose. However, according to the Baltimore City Health Department, the cost per dose in Baltimore has quadrupled over the past 2 years, quadrupled in 2 years. This GAO study would evaluate the impact of the ability of states and local health departments to reduce the number of deaths due to opioid overdose. It's a pretty simple amendment, and I would hope that we could get it pending and included in this legislation because I think it would save lives. The next amendment I'd like to talk about is one that is, again, a bipartisan amendment that is being offered with Senator Heller that would repeal the therapy cap. I was in the House of Representatives when the therapy cap was imposed on therapeutic rehab services. It was put in the Budget Act of 1997 and imposes an annual financial limit on outpatient physical therapy and speech language pathology services, as well as occupational therapy services. The decision to impose those caps was not based upon data, concerns about quality of care, or clinical judgment. Sole purpose was to limit spending in order to balance the federal budget. Mr. President, I was in the Ways and Means Committee room when Chairman Thomas brought this issue up to include in the Balanced Budget Act, and I asked the question, why are we doing this? He said, well, we need these dollar amounts to equal the numbers. I said, what's the policy reason? None could be given. These arbitrary caps create an unnecessary and burdensome financial barrier to Medicare beneficiaries who rely on essential rehab services such as physical and occupational therapy to live healthy and productive lives. Chronic pain, which is defined as pain that lasts for several months, or in some cases years, affects at least 116 million Americans each year. Physical therapy plays an important role in managing chronic pain. Recently, the Center for Disease Control and Prevention published draft clinical guidelines on the use of opioids for chronic pain, making it clear non-drug approaches such as physical therapy are preferred treatment paths for chronic pain. Approaches such as physical therapy have been underutilized and therefore can serve as a primary strategy to reduce prescription drug medication abuse and improving the lives of individuals with chronic pain. So I would urge my colleagues to join me and Senator Heller to permanently repeal the therapy cap and ensure that Medicare beneficiaries, including those suffering from chronic pain, continue to have access to medically necessary outpatient physical therapy services. And, Mr. President, the Fourth Amendment that I would like to offer is in Title IV of this legislation that addresses the so-called collateral consequences. Section 402 directs the Attorney General to establish a task force on recovery and collateral consequences. Collateral consequences refer to a penalty, disability, or disadvantage experienced by an individual because of a criminal conviction, but it is separate from the court's judgment or sentencing. The Commission will study these consequences and whether they affect the ability of an individual to resume their personal and professional lives. In other words, we're talking about reentry into society. But we do not have to wait for the results of a commission to take action to ameliorate one of the collateral consequences of a criminal conviction. And here I'm talking about the fundamental right to vote. An estimated 5.85 million citizens cannot vote as a result of criminal convictions, and nearly 4.4 million of those have already been released from prison. 4.4 million people are in our community and denied the right to vote. Nationwide, 1 in 13 African Americans of voting age have lost the right to vote, a rate 4 times higher than the national average. Latino citizens are also impacted in an extreme way because they're disproportionately overrepresented in the criminal justice system. States have vastly different approaches to voting with criminal convictions. This patchwork of state laws has caused confusion among election officials and the public, sometimes resulting in the disenfranchisement of even eligible voters. Some of these state laws are holdovers from the era of Jim Crow laws, where even a misdemeanor conviction could take away an individual's right to vote. In some cases, the right to vote is lost permanently with no ability for rehabilitation. This is just plain wrong. The amendment I would like to offer would provide much-needed information into the hands of citizens returning from incarceration. My amendment would direct the Justice Department to provide to individuals released from custody of the Bureau of Prisons information regarding their ability to vote following release. Require notification to individuals on the impact of their voting rights when they accept a plea agreement from the U.S. Attorney, and require the Department of Justice to report on the disproportionate impact of both federal and state criminal disenfranchisement laws on minority populations, including data on voter disenfranchisement rates by race and ethnicity. My amendment does not change any existing federal or state voting rights laws. It does not. It simply requires the Justice Department to provide additional information to ex-offenders upon their release from prison and make sure that defendants are aware of the impact of their voting rights when accepting a plea agreement. The Department of Justice study can provide us additional information on the patchwork of state and federal disenfranchisement laws, which Congress and the states can use to make further changes in statute. So I would urge my colleagues to have a process where this amendment, along with the other 3 that I've just discussed, can be made pending so that we can vote on these amendments. I think they all would improve the underlying bill. It's certainly consistent with the majority leader's commitments for an open amendment process, and I hope that there will be a way that I will be able to offer these amendments and the full Senate will be able to vote on these amendments. With that, Mr. President, I would yield the floor.